So good evening, my dear students. Today again, there's a diagram Friday. So as I have promised that every Friday we will discuss some diagram. And today I'm going to discuss how to draw the diagram of histology of cerebellum. It's a very important diagram, both for anatomy and physiology. And in your exam, this can come as a short note also and as an MCQ also, because a lot of questions are based on this diagram. So question number one, how many layers are there in the cerebellum? How many layers are there? There are three layers of cerebellum. Okay, the layer which has Purkinje cell, the layer which are having Purkinje cell. Okay, PC here is Purkinje cell. So the layer which is having Purkinje cell, that is called as Purkinje layer. Draw like that. The layer which has Purkinje cell is called as Purkinje layer, and the layer which is having granular cell, these are the cells with lot of granules. So the layer which is having granular cell will be called as granular layer. Very easy to understand. And from granular cell arises your parallel fibers at the topmost. So at the topmost there will be parallel fibers, and the speciality here is that they look like a molecule. They look like a molecule, and this is called as, that is why, molecular layer. This much is clear. So how many layers are there? MPG, molecular, Purkinje, and granular. This is clear. Now this Purkinje cell, these all Purkinje cell are actually inhibitory to deep nucleus of cerebellum. They are inhibitory to deep nucleus of the cerebellum. The Purkinje cell is the only output of the cerebellum. If they ask in the Viva, who's the only output of cerebellum? Answer will be Purkinje cell. Okay. So one efferent is there, and that is Purkinje cell, and they are inhibitory to deep nucleus. So one efferent, two afferent, three layers, and four nucleus. Very easy to remember. One efferent, what is that? Purkinje cell. And two afferents. There are two afferents, I told you. One afferent which is coming from inferior olivary nucleus of the medulla. Inferior olivary nucleus of the medulla. Okay. This is called as climbing fiber. This is called as climbing fiber. Very easy. So, if it is coming from inferior olivary nucleus to the cerebellum, this will be called as climbing fiber. Rest all, whatever coming from anywhere to the cerebellum, they are simply called as mossy fiber. Mossy fiber. They come from rest all of the places. There are so many connections going to the cerebellum. I will discuss in some other lecture in detail. But right now, I am telling you the histology. So we need to remember there are two afferents. If they will come from inferior olivary nucleus, they will be called as climbing fiber. If they are coming from anywhere else, they will be called as mossy fiber. Now, while ascending upward, first they will stimulate deep nucleus, plus means stimulation or minus means inhibition. So first they will stimulate deep nucleus, and they will stimulate again Purkinje cell to inhibit deep nucleus. So after function is over, deep nucleus will be inhibited. So while climbing, okay, so while climbing fibers will stimulate deep nucleus, then they will stimulate Purkinje cell to inhibit deep nucleus. Very easy. In case of mossy, see, in case of climbing, it's very clear. It comes from one place, it goes to one Purkinje. So no confusion in that. It is okay. But in case of all the other, which are going inside via mossy, they will not only stimulate one, they will stimulate multiple Purkinje cell via granular cell. This is not good. So they are coming from multiple places, and after resting in the granular cell, they will stimulate multiple Purkinje. This is not good because in the climbing, it should stimulate only one Purkinje. So, how to, manage this chaos? The chaos which is uh, done by this mossy fiber. So, you will need bodyguards. Bodyguards why? Because multiple Purkinje are stimulated. So, you have to inhibit those extra Purkinje, and those bodyguards, those inhibitory cells, if they look like a star, if they look like star, they are called as stellate cell. If they look like star, they are called as stellate cell. If they look like basket, so basket looking cell are called as simply basket cell, stellate cell, basket cell. And if they look like Golgi, then it will be called as Golgi cell. So all these nucleuses are inhibitory, inhibiting extra Purkinje cell. Very easy to understand. Why? Because Mossy has created a chaos. So to balance out that chaos, you need to stimulate only one Purkinje cell. So that will be balanced by inhibitory effect of stellate cell, basket cell, and Golgi cells. Clear? So this is about the basic diagram. So there is one efferent. You can understand here. How many efferent are there? One efferent per Purkinje cell. Two efferents are there. One is climbing fiber, second is mossy fiber. And there are three layers: molecular, Purkinje, and granular. Now, what about four nucleus? Deep nucleus are four. Deep nucleus are four. And the mnemonic is DEGF. Don't eat. GF means greasy food. D is dentate nucleus. E is emboliform nucleus. G is globosus, and F is fastigii. Emboliform nucleus and globosus combine together to form nucleus interpositus. Nucleus interpositus. So today's micro session purpose was to let you draw the histology of cerebellum and to understand that there is one efferent. Okay, there is one efferent. What is that? Purkinje cell. Inhibitory. It is negative charge, not charge, but I'm just telling you. If it is negative, it means inhibitory. Just for reminder, two efferents. Climbing fiber comes from inferior olivary nucleus, going up to one Purkinje. Other afferent will be mossy fiber, coming from rest all the places and going to multiple Purkinje. And those excess Purkinje will be inhibited by inhibitory cells like stellate, basket, and Golgi cells. Okay, so I hope this is clear. So this is it for today's session. Next session will be on the Monday. So every Monday I'll be discussing conceptual physiology, and the Friday I'll be discussing the diagram. Thank you. All the very best.